For that. Today we have an amazing session. Therapy is a critical tool for restoring and advancing the mental health of all, and especially black men, as many of you may know. But it's what happens, and this is the critical question, what happens between therapy sessions that builds and maintains a foundation of mental wellness. So I'm personally excited about this session. And in this session, you will learn from mental health practitioners. Thank you all for being here. How to use everything. It's a toolbox, right? From nutrition, exercise, stress management, and sleep habits to limit mental illness. And I love this word, protect, enhance mental health. Please join me as we kick off this panel. Excited to have my colleague here. Welcome the Vice President of Diversity, Equity, and Inclusion of UnitedHealth Group, Kevin Henderson. Let's give Kevin a round of applause.
Good morning. It's an honor and privilege to be with you. As he said, I'm Kevin Henderson. I get the honor to represent UnitedHealth Group, which is a diversified healthcare company. We really look at the well-being from a holistic approach perspective. And when we think about UnitedHealth Group's purpose, it's really to make sure that people can live healthier lives and make the healthcare system work better for everyone, including our black men. When we think about well-being, right, when we think about what we need to do to make sure that our people are getting culturally relevant care, one of the things that UnitedHealth Group has done is really invested. Through our foundation, we have invested $100 million over the next 10 years, really seeking to provide scholarships to those that are clinicians and going into healthcare spaces, right, to really educate them and make sure that when we are going to those doctors' offices, people can see us and they can feel connected and, right, they understand what we're going through. And this session today is very, very critical. When we think about the black man, I think in some of the previous other discussions, we've talked about us being so strong, right? But what does that really do? That can take a toll when we have that pressure. And so this panel is an opportunity to understand what we can do from an everyday perspective. How do we actually change the lifestyle, not just from simple habits, but maintaining mental health and really having a more focus on well-being. And so I'm not going to prolong the time. I'm excited about this panel, and I'm going to turn it over into the hands of our moderator, Dr. Darren.
All right, we are going to get started. My name is Dr. Darren Moore, and I am a clinical professor in the Marriage and Family Therapy program at Northwestern University. I'm also the owner of I Am More L.L.C, where I provide individual, couple, and family therapy. We have our three esteemed panelists that are going to introduce themselves. We are going to engage in a critical dialogue and a critical conversation around mental health as it relates to black men. And so we're going to engage in that, and then towards the end of our time together, we will have an opportunity for maybe about 10 minutes or so for a Q&A. All right, so I'm going to lift it to my first colleague on my left to introduce themselves.
So Chazz Scott, I'm a mindset and resilience coach. I'm also the founder of Supra Mentem, so I provide coaching to entrepreneurs and leaders to help their lifestyle habits and burnout, as well as mental health, as well as performance. Happy to be here. I'm very excited.
Dr. Obari, Cartman, clinical Ph.D., a father first. I do a lot of work with black men and boys in the juvenile detention centers, prisons, high schools. I like working with young people, integrating art, culture, wellness, spirituality, all into the same therapeutic pots, and creating community access for these kinds of conversations. I'm happy to be here.
Kenneth, Poole. Good morning, everybody. Happy to be here. Chief Medical Officer, focusing on experience for UnitedHealth Group. So part of the team that sets the clinical direction for our organization. Also a practicing internal medicine physician. I'm a supplemental staff physician at the Mayo Clinic in Rochester, Minnesota.
Excellent, excellent. All right, so let's start this process. Can we talk a little bit about what are some of the issues, the mental health challenges that are often plagued as it relates to black men?
Where do we start, right?
Exactly.
So I'll jump in. I mean, there's two things, right? And we're gonna focus a little bit on the former, but I'm gonna bring up a second element. So first, you talk about just stress, anxiety, pressure. And these are things that, number one, everybody deals with as it relates to being high functioning or just a functioning, adult or a person in society. But when you specifically look at Black men and where we are seated within this country, right, the historical events that have influenced our place in society, those things become heavy, right? And so you have that kind of like these external factors, right? And like I said, we'll probably talk more about how we can best handle those things. But I think one of the other things that we don't really tackle well is kind of some inherent issues related to anxiety, depression, from a purely clinical diagnosis perspective, right? So sometimes things externally aren't that bad, and we are in a good place, but for whatever reason, we're still just not feeling good. We're not feeling ourselves. And I think those are the times where sometimes we get a little bit uncomfortable of not knowing what to do. Who to go to, how to approach those things. So there's some inherent things that, people are maybe clinically predisposed to: depression, anxiety, social anxiety disorders, obsessive compulsive disorders, bipolar disorder, schizophrenia. Those are mental health challenges that are real and sometimes uncontrollable in terms of their onset. But like I said, there's also those external factors as well.
And so as you think about that, can you all talk a little bit about how do some of these mental health challenges, when they do occur, how do they impact Black men in terms of their personal lives, professional lives? Can you talk a little bit more about that?
Yeah, I want to piggyback off of what Kenneth said. So one of the things, back in 2017, I had all the material items of what success was. I had the car, I had the nice condo looking over the Potomac in Washington, D.C. I had the six-figure salary, and yet I was still burnt out, I was depressed, and I felt hollow inside. So I had all the material items of what success and what happiness had what I thought was happiness and success, and I realized I felt still hollow inside. So when you talk about, the things that we're going through, and the things that we're trying to chase, we want to make sure that we're doing the inner work that is required to fill up our cups. As Black men, we're told to be this, to be that. We're wearing so many hats, and one of the things that we don't do is take the times for ourselves, particularly for me in the morning, to ground ourselves, to do the things that are required for our mind, body, and soul in order for us to live out our potential. And one of the things that I realized in my own life was having the right lifestyle habits, having a right diet, having a morning routine, having prayer regularly, having meditation regularly, and doing the things that are required for your mind, body, and soul to truly reach your potential. But not only that, to sustain your health, to sustain your performance, to sustain your happiness. What's the point of working so hard, climbing up this mountain, you're burning yourself out, you get to the top of the mountain and you realize you've been climbing the wrong mountain, and not only that, you haven't been enjoying the process. What's the point of life when you can't enjoy the fruits of your own labor? And I got that in 2017, and I went on a journey to read every book I could in psychology, neuroscience, spirituality, to understand how to improve the quality of my life, because what I was told wasn't true. Mm-hmm. And I went on a journey to do that, which led me to write my book, Success Starts Within, Achieve Your Potential Through Radical Self-Care, because you have to fill up your cup, not only to achieve your potential, but sustain your life to actually enjoy it.
Yeah. And I love that you wrote, right, that's such a powerful testament to your experience, because when you said I read all the books, my first thought was how I got a Ph.D. in white psychology, read a bunch of old white men, Freud, Skinner's, Jung, and then had to go back to Chicago to heal Black men and boys on the South and West Side. And there was an incongruency between the cultural perspective of the experts and the experiences of the people that look like us in this room. And so we need to contribute to the canon of how we conceptualize what health and wellness is for us. We got our own definitions. We the first people on the planet. Right? We know some things about what it means to be human, what it means to be well. We have to lean on those things to conceive of a path out of, right? So that means the conceptualizations of manhood have to be shifted. We have to learn and study different ways of even understanding what it means to be a man. The brother earlier said a lot of men are strong, and then we get tired from being strong because we still don't conceive of being honest and vulnerable as strong still. We got to take strong off to be emotional. We got to, when we cry, we tap into our feminine side. Right? We still think about things outside of our manliness to be human. Right? We still think soft is weak. I was in the ocean last night. Right? We think about water being soft. It's the most powerful element on this planet. There's a strength in the water that I was in. You think about the strength in breath. There's nothing soft about, right? There's a power in these things that we conceptualize as weak or soft or less than. And that's a manhood concept. We have to change the way we fundamentally view what a man is, what a man does, and then that changes what success means, what wellness means. And we have to have these conversations amongst ourselves to be able to move that conversation forward, I think.
One of the things that I think is important also, you hear this term self-care, right? What is self-care and what does that look like? And then can you tell me a little bit about what's the difference between self-care and therapy?
I mean, I think self-care is about prioritizing yourself, right? I mean, the best, analogy one of the best analogies in terms of health and wellness that you could take with you through life is when you get on the airplane and they tell you before you help somebody else put a mask on, you got to put a mask on yourself, right? And so, all of the demands that we may have, family, our own families or the families that we come from, our parents and, extended families, work, school, whatever your thing is, social obligations, you got to take care of yourself first. And so I think about self-care is really prioritizing yourself and creating balance in terms of your diet, your sleep, again, and then even like your outlets, your recreation, and then also your village, however that may look. For some people it's a physical village, for other people it's virtual, it's so on and so forth, right? But I think it's about prioritizing yourself first and foremost before, we talked about that cup, right?
Right.
Before you're able to give to others.
Yeah. And for me, the center of it is a question of worth, of value. Black men take care of the stuff that we care about. If it's our car, if it's our clothes, should we invest in the things that we find worthy? If we got to see ourselves as worthy enough to prioritize, to schedule it, just like you do work, just like you do recreation, schedule time for self-care. The difference between self-care and therapy for me is that self-care is comforting, it's easy, you're doing things that make you relaxed. Therapy is not always easy. Therapy doesn't always feel good. Therapy is hard, it's work. You got to look at yourself. You have to be honest in a way that might not always feel comforting. And so there's, on the other side of therapy, there's goal setting, there's digging, there's accountability. When you self-care, you really want to focus on just the ease. But if you want to do therapy, you got to be ready to look at yourself. And some of that stuff ain't always pretty. And that's fine. You can do it without judgment, and you can sort of overcome those things. But, you might not be happy when you leave a therapy session, but you might be better, which is different.
When we think about the topic of therapy, how does one, find a therapist, or how do they look into that? I think there's lots of conversations around that, but can you elaborate on how do you identify a good therapist or someone that would be a good fit for you?
That's another tough question, and I think it depends. It depends on, again, where you live in terms of the number of therapists that are around, what you're specifically looking for in terms of a therapist. It also depends on insurance coverage. Is this something that's a covered service, or is this something I have to pay for out of my pocket? And then also kind of what is the goal? Am I just looking for somebody to talk to, or am I looking to work through something that is a little bit more significant, more severe, right? I think, now, this is kind of my bias and shameless plug, I think that at the center of health and wellness is everybody having a good, strong relationship with a primary care physician, all right? And I think that that's the gateway to good physical and also mental health, because that's somebody to not only help guide you through your healthcare journey, but to also advise you of where to go, getting at your question. So there may be times where you need a talk therapist And this is somebody that can help you through the process and provide you the resources. There may be times where talk therapist is not enough, and we need to have an honest discussion about medications, which is something that's totally, we talk about black men, black folks, but certainly black men as it relates to medication for anxiety, depression, and things like that. You know, hey, we got, and black boys too, slippery slope, we gotta watch that. But having a good relationship with somebody to help you discern when that's appropriate and when that's not is important. So my long story short is I think that having a good primary care physician is a good guide towards helping you figure out where to go in terms of mental health services.
Sometimes I feel like these conversations can be dishonest from my perspective as a therapist. Because we're saying go to therapy, everybody go to therapy, but the reality is that there's a national shortage of therapists. And not even black, there's a national shortage of providers. And so in this moment, I think that we do have to be more creative about what therapy looks like, where it can be accessed. This room might be a little bit more resourced than the ones I'm in typically. And so y'all can find it, but like y'all cousins might not be able to, right? And so like the access to a provider and to insurance, those kind of things are real things. I get calls every day looking for referrals. I got texts right now. And I don't have places to send people. I'm a president of National Association of Black People. You're like, I got networks of therapists, and everybody I know got waiting lists. Everybody I know, they're saying, please stop sending people to me, right? And so like we have to, the scholarships for the workforce development is important. But we have to encourage young people to see the value of being in these fields and the money you can make from it and the work you can do that's valuable. And also, in the meantime, think about barbershop therapy, think about using spirituality. There was a yoga class sister invited me to yesterday. We're thinking about sort of these alternative holistic therapies because sitting one-on-one in a room might not be the thing that we all have access to. If you do go, and it's beautiful and it's powerful, if you can't, then find something else, like find your therapies. There's lots of therapeutic things that we need to be able to do. And it's different than therapy. It's like therapy is a specific process, but we just gotta be honest that everybody ain't gonna be able to have access to it. And we need to create different divergent pathways that are more community-based sometimes than like the traditional office.
One of the things I want to go back to is this question around access. And one of the things that you mentioned was related to having a strong relationship with your primary care physician. Can you talk a little bit about how do we create that relationship between patient and primary care provider, specifically when we think about a lot of people in the black community, and specifically black men, don't go to the doctor or have issues or concerns with going to the doctor. So how do we create a shift in the relationship between patient and primary provider?
Right, no, that's a great question. And it's like you mentioned, you talked about essentially how you create safe spaces for black men and black boys through your counseling and the work that you do in the community. On the healthcare side, we have to be intentional about having providers who can do just that from a physical health standpoint. And it's something that the alarm has been rung within healthcare, and we know that there's a shortage of black male doctors, and there are some concerted efforts to look into that and to alleviate that, although, again, speaking quite frankly, I think we may be taking a step back given the affirmative action ruling, but that's a whole other discussion. But as it relates to the relationship, though, on the consumer side, on the patient side, I think that it's important for people to shop and to scrutinize. And we all know it, like when we look at our parents, grandparents, or whatever, they go to these doctors and they come back and they'll complain and be like, yeah, my doctor said this, or mama's doctor said this, or whatever, and like not be having a good experience. And it's like, well, why don't you see somebody else? Well, I don't know. Well, I don't know if I could transfer all my stuff, or like you're paying them for a service, and you're paying them a lot of money for a service. And so I tell people, like, shop for, like, you go visit a new church home, and it just doesn't resonate with you because of the choir or the preacher or whatever. You're visiting somewhere else. You meet with a financial advisor, and it's like, this is not really my vibe. You go somewhere else. Same thing for a healthcare setting. And so I tell people, look around. find somebody that resonates with you. It may be a cultural thing, or it may just be something else that makes them familiar. And they have to be able to, as we talked about, meet you where you are, right? There has to be open, honest communication. You have to be able to tell them anything so that they can help you. And they have to be comfortable with you as well. And if it's not there, go somebody else and give them your business, essentially.
I want to speak upon that from like a personal experience. For me, I mean, in terms of, you know, seeing a new healthcare specialist, I mean, my primary care specialist is the same person I've seen since I've been in high school. But he does a great job, right? So finding a healthcare resource in your area is very important, and you have developed that relationship with that individual to get the care that you need. It's like dating. You got to find somebody that's right for you, and I think that's critical to be able to open up. But I just wanted to add to that. If it works for you, that's fine. But if it doesn't, move on, date somebody else. So I think that's important.
So I think part of what I'm hearing is that there has to be a certain level of self-agency skills that individuals have to have, right? So they have to be able to feel comfortable and feel safe enough to reach out and ask for help. So can you talk a little bit about what does it mean to ask for help, and how do people do that when we are within a society that sometimes makes it difficult for us as Black men to say, hey, there's something wrong, or I feel like there might be a concern, when there's all these issues around dominant notions of masculinity that prevent some of us from doing that. How do we sort of shift that perspective so that we can have more people who feel comfortable, feel safe around asking for help?
I think that it would be helpful for people who have achieved levels of success to be more honest about how they got there, to model the reality, which is that no one makes it alone. Like, you post on the gram and you make it look like I got it and I made it, but the truth is there were always people along the way. And we just don't see that part of the story. So we have to show it. We have to say, I didn't get here. Like, people poured into me, and I can name them, and we want to model what that means for us as men to change the narrative that this is an individual struggle, right? We a community, we a collective, strong or weak. And so everybody that's ever achieved anything has done it through getting help. And it's the illusion that happens magically, or is lucky, or your talent, or your gift. I think we can dispel that, particularly for people that are watching us, and everybody's influencing somebody, to just remind them, I mean, I did it, I did well, and I worked hard, and somebody helped me along the way. I think we can change that narrative with our stories.
I would add to that too, that, and this kind of goes back to that primary care piece, that we need to do a better job acknowledging when it's time to tap out. All right, and what I mean by that is this. So I said I'm a primary care physician in terms of background, and when I would see white men, even white women, come into the office for a physical checkup or whatever, and they say, you know what, I'm not doing that well, I think it may be time for me to go on something. That's literally the conversation. Right, so I kind of have to like tease out and make sure, like, look, do you really need a medication, whatever, let's make sure you get to go, and then let's start you on something and go from there. Because most people that are on antidepressants, anti-anxiety medications, those are usually started by a primary care physician. You're usually not going to a psychiatrist until we try 2 or 3 different times and there's a swing and a miss, and then we need a psychiatrist to kind of help with the medication management. But when we talk about our Black patients, particularly our Black male patients, there's a huge reluctance there. And that was that piece that I talked about in the beginning, because we have all these external forces that are like beating at us every day, right? Like that are in our backpacks, on our shoulders. Again, from hundreds of years of history to the stuff that we deal with, microaggressions, macroaggressions, whatever you want to call them now. But sometimes there's that chemical imbalance that is there regardless of what's going on externally, right? When you talk about clinical depression, we talk about clinical anxiety, generalized anxiety disorder, and things along that spectrum. Those are things that are chemical imbalances internally that talk therapy certainly been proven to be a benefit. Good lifestyle, physical health have certainly been proven to be a benefit, but for everybody, that's not enough. and being comfortable to at least have that conversation with somebody you trust to determine, should I take something additional or not? How does that jive with me and my spirit, with my values, with my other physical ailments and things like that? Those are important things, and those are important conversations that we need to have, because, and I say all that to say that so many of us are carrying extra baggage because we're untreated, in addition to being beat up more than any other group in the country anyway. And so it's important, like I said, to have that person so you can have that conversation, which is a real one, around, again, what else do I need to add to take care of myself?
I just want to piggyback off that real quick. One of the things that you touched on, which was critical, seeking the health care that you need, whether it be medication or therapy. One of the things that I've come to in my life and what I've seen out there are the lifestyle habits that are contributing to your mental health, having the right diet, getting exercise. There's new studies out here that actually say that at least 150 minutes per week is up to 1.5 times more effective than antidepressants or cognitive-based therapy. Now, that's not to say that cognitive-based therapy and antidepressants don't work. They do under the right circumstances, but your lifestyle habits and the things that you're doing daily ultimately contribute to the quality of your life, and I think that's important. I wish somebody had told me these things, when I came out of school, and I thought it was work hard, get the money, get the car, get the house. You burn yourself out, you get depressed, and you're hollow inside. The things that you have to do to fill up your cup are critical, and that's why we're talking about the things that you do outside of therapy. And the gentlemen that are on the panel today, they mentioned the importance of seeking the care that you need. And one of the things I have to say, and all of us understand this, I understand most of you do since you're here, is seeking the care that you need and being vulnerable is power. There's power in that, because you know who you are. You know that there's something missing that you need. Most people don't know that there's something missing, so they don't seek the care or the help that they need. For me, I needed the therapy. I needed to change my lifestyle habits. I needed to have the right self-talk. I needed to have the right diet. I needed to do the meditation. Those are the things that you need to do to enhance the quality of your life and sustain it so that you can fully give out and live out the truest expression of who you are as a black male.
And real quick about that, so we're talking, we've said several times, add new lifestyle things, habits, diet, more rest, more exercise, more green vegetables, more water. There's also a part of that that means remove things that are part of your daily habits that are also getting in the way. We can blame white people for some of it, but some of it are our own lack of discipline, right? So if you scrolling too much, or if you drinking too much, right? Some of this, there are things we need to detox from that are in our daily habits. Sometimes you need to fast from things. So we need to remove some people, right? Some habits. So some of that is add things. Some of it's take away things. And just being honest about that. Like doing an honest assessment of how you spend your time, what are your habits, looking at that, and then thinking about what serves me, what doesn't serve me. And then, you got to really assess that and then have the discipline to act out what you know you need for yourself. But it's hard to do it if you're on a rat race, if you just to-do list, if you just chasing something. Right? Part of what we're talking about is pausing for a moment, taking some breaths, and then having an honest look at yourself, and then doing the work, right? So a therapist can help with that, but you could also have a community of men that you decide to go through journeys together to help with that, just to have regular check-ins. That don't cost nothing. It's just the deciding to prioritize that could change somebody's life.
One of the things that I think is also important to note is that we know from research that there's a correlation between stress and anxiety and depression and hypertension, right? So I think sometimes we as black men don't recognize that there is a biopsychosocial sort of aspect, and that we have to really think about the connection between mind and body as we think about potential health issues. One of the things that you had mentioned, though, specifically was around this idea of taking a pause. We are in this society where a lot of us are perhaps first-time college graduates. We have a lot of maybe stress to be the one or to be successful, right? I mean, everyone in this room is successful. And so we often have these mixed messages that say, achieve, work harder than anyone else, and all of these things. So can you all talk a little bit about what is work-life balance, and is that something that's real when we think about contemporary lives of Black men? And if so, how do we achieve work-life balance as we think about mental health among Black men?
It's big. I mean, I think it's about creating an identity or being comfortable with an identity that you're fulfilled with. Because you mentioned something. We gave introductions. He's like, first thing, I'm a father, right? Like, that's important to you. That has nothing to do with your title. That has nothing to do, like, that's important to you. And I think that finding those pieces of our identity and for some people, you may just like being a lawyer or something like that, right? But like, whether it's being a dad or being a husband or being a coach or being a competitive cyclist, I don't know, whatever people's thing is, right? Like, I'm still into basketball or whatever your golf. I think that, like, finding something that you're fulfilled with that brings you joy and leaning into that and being that first and then everything else second, I think it's like part of that balance. So like when you mentioned like I'm a father, and you said that like, very affirmatively, like that, like that's it. Like that's part of it. Like he just showed balance in the first 30 seconds, as opposed to, like I said, leaning into things that a lot of times cause us stress. Because a lot of us, our identities are our work, our social medias, our flex, what we lead with is our work. And a lot of people don't like their work. Like, a lot of people don't like showing up, So why am I leading with that as that's who I am? Like, I don't even like when I go. Like, I actually kind of enjoy when I'm doing this. So let's lead with that. And I think that's part of that balance.
Yeah. I mean, we kind of grow up feeling like we impose on our children this need to be something. What the children teach me is that they just be. They are. There's no being a accountant, a lawyer. If they feel like drawing, they draw. If they feel like running, they run, right? So we still always need to have moments where we just get to be, just exist, without the titles, without the chasing nothing, without being something in the eyes of someone else. Like, we need to tap into our natural essence, the God-given gift we have to just breathe air and just be, and have that be a reprieve, and define success by that. It's hard for me to be here because as a father, one of the things that I pride myself on is picking my kids up from school every day. And so there are times when I can't take a out-of-town trip just because, like, I already went to Miami last week. So I turned down money and opportunities because my identity as a father and my relationship with my children is most important to me. And so I lose some bags, but I gain the integrity and the peace of mind of living a life that is defined by my version of success. Not by what nobody else look like, not by what TV or the scroll like. I have my own version of success that I'm achieving through just the being of the living of the experiences that I get to enjoy. My father didn't teach me that. My father worked too much, in my opinion. He thought he did it for me. He thought he was doing it for us. I wish we spent more time together, right? That's what that was the value that was the currency that mattered the most to me. And so as I became a father, I had to live that. And sometimes that means compromise. And sometimes I don't have as much money as my dad did. But my kids are not gonna say that I wish I had more time with my dad. They're not gonna wonder if their dad loved them, right? That's a decision to make. And there's always things you give, you take, but it's gotta be based on a value system that you have that I believe has to be defined by you and can't be somebody else's dream for you. Because in this world, they will use us, our gifts, our talents, and they will extract everything they can from us and continue to rise to profit, and we will be depleted over and over again, and they will just find somebody else to replace you. That's not living. That's the trauma of the sun up to sundown, right? That's the productivity mindset, capital. I mean, that's not living. That's not wellness. And we have to define success and wellness on our own terms. And I'm a black folk in the room, we can do that. I mean, I know some of y'all are sponsored by work, and that's fine. But like, we having this conversation right now as black men trying to figure out how to elevate to our highest expression of self, and we can define that based on what we know is true to us. And can't nobody stop us from doing that.
That's definitely a great point. I think the other thing that I'd like to point out, as we're talking about work-life balance, You're right, there are lots of successful people in the room, and you may work in organizations or structures where you are responsible for supervising other people, right? And so can we talk a little bit about what are some of the elements that the workplace environment can do to also be conducive to Black men and having work-life balance? So for example, I'm a father as well, a new father. And one of the things that I had access to in my specific position was parental leave, right? So I actually had access and the privilege, let's be very clear, to be able to take some time off to be able to connect with my daughter. Right. But not every person has access to that. Not every organization has that even as a mission. But can we talk a little bit about what can people do that are in positions of leadership, right, to create more opportunities for work-life balance for employees?
Yeah, I do want to piggyback off of what you said because I thought it was critical here as a father. I was thinking about a quote, I can't even remember where I heard it from, off a podcast or something, but in relation to you and showing up for your kids, there's a quote that says, the only people that remember that you worked so hard and stayed so late at the office are your kids, and it's usually for the wrong reasons. Right. So props to you for that, my brother. It's really important. That's success. So to your point, though, especially in the corporate arenas as well as leaders, it's really important that they set the precedents. For me as a leader in the work that I do, one of the things that I do, and I've talked to many people that have been here at the conference, it's really important that you set time aside for yourself as a leader, because that trickles down to the people that you lead. At 5 o'clock, phones go down, emails go down, do what you need to do to fill up your cup, because people see that. When people are looking for models to figure out what success is, and they have a balanced life, they have a great diet, they know how to take care of themselves as well as lead a team, that is how you show up as a leader. Now, I get it. There's certain times where you may need to get a call out 7, work until 8, work until 9, until 10, but you want to make sure that you create balance for yourself as a leader so you can show up more effectively as a leader. But not only that, you represent a model to others in terms of what success actually is. Okay? You can have the money, but you can also have a family. You can enjoy life and still maintain your quality of life and enjoy it at the same time. But you have to set the precedents. You have to show up as a leader. And to do that, it starts with you as a leader.
Excellent points. And one of the things I also would ask, we talked a little bit about fatherhood for some of us. Can we talk a little bit about relationships? So for those of us who are married or dating, and we think about how do we prioritize mental health so that it doesn't negatively affect the relationships that mean the most to us, including our relationships with children, but also potentially our spouses or even other family members?
Yeah, you don't want to come home and fight there too. So
It ain't well.
Yeah, it's like, but yeah, no, I think when you talk about, because we're at a corporate conference, and when we talk about invading corporate spaces as members of large organizations and even as entrepreneurs, it's about having a good support system, right? However that looks, and that's different for different people. And so I think it's important to have somebody in your life, a partner, or if you choose to have a partner, that partner needs to empower you, enable you, and essentially, like I said, be a partner in your journey, your success, like your pathway. When that person provides energy that moves things the other way, that's tough. Like I said, I think that it's important that whoever is in your life, in terms of that's going to be somebody that's a partner that's going to live in your home, that person needs to, again, be a partner with you along the journey. And if they're not, then, again, you're just adding extra problems on top of what you already got to deal with.
If I just add one thing real quick, in terms of relationships and meaningful relationships at that, they did a study at Harvard and they wanted to understand what makes a happy and healthy life. So they did a study over the course of 75, 80 years, took blood samples, did interviews of their kids of these individuals, of 724 men, and they wanted to understand what makes a happy and healthy life. And what they determined it wasn't how much money they had or the house that they had or the car that they had. It was meaningful relationships.
Yep.
Those individuals that lived longer but also enjoyed their lives had meaningful relationships. So when we talk about success, when we talk about health and self-care, ensuring that you have meaningful relationships, connecting with like-minded individuals, so important to your health. That's success. That's what we need to focus on. So relationships are critical.
Yeah.
Absolutely. Well, I really appreciate all of the comments and the perspectives. We're going to actually take some time for some Q&A. So if there's anyone that has any questions, if you could please come to the microphone. If you could please state your name, state your place of employment, and then please be as concise as you can with your question.
Good morning. Good afternoon. Thank you very much. My name is Chris Turner with AARP. First off, preface it, I suffer from bipolar disorders, suicidal ideation, anxiety. So I thank you all for very much having this conversation. For that last bit on family, dealing with some issues with my wife because she's not a big therapy type person right now too, so appreciate your comments. My question is this: you got a bunch of executives here, a bunch of business people here. How do you talk to executives, how do you talk to employers, about going up and using their time and talking to their employer about certain things they're dealing with, and also exercising the fact that, we've had this sick leave, this also can be used for this medical leave, and also being able to try to set those boundaries and expectations. I'm lucky, my boss understands, but how do you talk to the people up top and say, hey, you need to make sure you're taking care of the people that are working for you?
I know for us, if you really want to have a really frank conversation, you go to the numbers, all right? And so we, like from my perspective, like I oversee our physicians that are employed throughout UnitedHealth Group, and we go to the voluntary turnover numbers and the cost of losing a physician that we have on staff with us, whether that physician is doing like case reviews and things like that on the benefit side, or they're doing care delivery, and also the cost of onboarding a new physician. You better make sure that the ones that we got are happy and they want to stay here, or else it's a business thing. And so for those who don't have the natural compassion, just go straight to the dollars. And that's the conversation that we have.
Yes, sir.
Good afternoon. My name is Demarius Davis. I work for Walmart. As someone who has been on the mental health journey, has switched from Lexapro to Prozac, grateful for telehealth, which is how I go to therapy, which is every other week. My question is on the subject: as more and more people understand and mental health is destigmatized, as that is going on, how do you see that affecting like relationships with, like, let's say our parents and grandparents, and trying to get them to understand and connect? Because from a generational standpoint, like, they still have these ideas, and we're trying to help them from the information we know, because we know you know as much as you know. But what would be your suggestion as we're trying to, as we know better, we do better, to connect with our blood relatives to do better when they're not, I don't want to say on the same level, but they're not as open to the idea of seeking mental health. And this is coming from someone, and I'll be fully honest, like, I've had 2 people die by suicide on both sides of my family, which is the reason why I sought mental health to begin with. So I'm just trying to get a better understanding of, like, what your viewpoint on that is, as it's a generational thing, to have that more open dialogue so we don't lose out on those relationships that you spoke on earlier.
I think at the center of this conversation about relationships and sort of building community is compassion at the center of it, and having some patience with all of our family members and community members about where they are, what level they are, and some humility about the information that we get. I love the mental health movement. Everybody sort of got more information, but sometimes that information can be weaponized. Sometimes that information can be distorted. Everybody's not a narcissist. All your exes were not, you know what I'm saying? Like, so we have this, everybody is diagnosing. One of them is, right? Okay, I'll give you the one. Odds are, right? But so we have more information, but not as much of the value system that our older generations had around community, right? And so there's things that our grandparents had that we lost, and things that we gained that they didn't have, right? And so the combination of it, I think, is the brilliance. So when we can sit with, right, and understand what was the thing that you had that I need, and the thing that I have, and come together with some humility and compassion, I believe that we can sort of work some things out and decide when to have boundaries when we need to have boundaries. Which don't mean cut your grandmama off, right? But it means understand the limitations of the kinds of conversations you can have with her, but still find the value in the things that allow you to connect with her at her pace.
Right. And I just want to add to that real quick. Keep doing what you're doing, brother, because you'll be an inspiration for your other family members. There's people in your family that probably have had some things that they don't want to deal with, flat out. And they don't want to go back to, they don't want to talk about, and they're afraid. You be that inspiration. Keep doing the good work.
I would just add to that. One thing that I would say is that I think we have to also be thoughtful about the individual's context. So what is their frame of reference, or what points of view are they utilizing? So for example, I live in Georgia, and so that's the Bible Belt. People know the Bible. People know about that, and that's typically what they use as they talk about issues or problems. And so being able to connect therapy and mental health and spirituality, I think, can be extremely important. And so some of my work, I actually work and talk with a lot of pastoral leaders who then can assist with shifting the conversation around mental health, instead of thinking that mental health is bad or not relevant as long as you pray, right? So I think if we can focus on looking at the context by which people, come to the table with, and utilize that, that can also be successful.
Thank you.
Terrence Trent, the second Travelers Companies. It's for Mr. Scott. You mentioned something about 150 minutes of, was it just, what can you clarify what it was they were supposed to do from the health and wellness perspective that it's 150 minutes of? Was it exercise or something else?
Yes, 150 minutes of exercise. Estimated 150 minutes per week is up to 1.5 times more effective than antidepressant or cognitive-based therapy. And that's not to say...
It just means just movement, too. Like
movement, movement anytime. Yeah. But that's not to say that cognitive-based therapy and antidepressants aren't effective. They are effective for what, you seek the treatment that you feel like you need. But if there's something that you're not doing in terms of movement and exercise, we know the mind-body connection. It is very effective in changing the brain chemicals in your brain, dopamine, serotonin, and changing your body chemicals to be happy. Come on, man, we on this earth to be happy and to do good work.
Okay, thank you.
All right, yes, sir. I think we have time for just a few more questions.
Right, and then we can take the conversation outside.
Okay.
With our professionals.
Absolutely.
All right, thanks for having me, guys. My name is Sean Herron. I'm an investor, real estate developer, and consultant. I want to make a comment, then I had a question. I think it's very important that we take a look at mental health as something that we have as preventative, and not as something that we only address when there's a crisis. So some of these things is like the health, the exercise, the wellness, we need to do that before, and also be a self-advocate and really study mental health and recognize any symptoms and signs that you may have and see when you need help. So my question is, I've had a couple of bad therapy experiences, and therapy is like dating. You got to find someone who resonates with you, who gets you, and then also who understands and can give you good advice. So when we're talking about people who are in a crisis situation, the last thing they want to do is go on UnitedHealth and be on the phone for an hour figuring out, what therapy is covered under your situation, and then find a provider. What advice would you give to someone in a crisis to find help immediately?
Unfortunately, the emergency room, if you're in a crisis, call 911. In most cities, in Illinois for sure, there aren't infrastructure. We don't have infrastructure to deal with the mental health needs of most communities. So your first point I think is critical. Prevent, lifestyle, don't wait until it gets so bad that it's an emergency. But if it is an emergency, don't hesitate to go take yourself to the emergency room just immediately.
And I would thank you for that. And I would add, again, kind of going back to that primary care doctor piece. I'll give you an example. So again, we talked about like people being treated again or for, again, anxiety, depression, different, behavioral health diagnoses, or being directed towards therapists and things like that in conjunction with their primary care physician. There are times when people come with specific life events that are urgent and that are weighing on them, but are things that will likely get through in terms of normal grieving or normal dealing with things. The death of a family member, particularly sudden loss, again, loss of a job or things like that. And in those times when we're not able to direct, there are sometimes even medications that, and we have to be extremely careful with these, that people can use on an as-needed basis for a short, finite period of time. So there are times where I say, okay, look, we're going to give you a little bit of this just for the next week and a half, and then we're going to stop that, but just to kind of help bridge you through this issue. Because again, and like I said, most of the time I've had that conversation, it's not with somebody Black. And being able to have that conversation and give and take, I think is important.
I guess to add one more thing is like one thing that I found is that going to therapy when I'm not going through a crisis really helps me figure out my core issues, like what's really going on and what got me to that place to keep me out of that place in the future. Yeah. So thank you guys, I appreciate it.
Thank you. And we're actually gonna have to close here, but I do want to just mention that yes, I think it is important to think about therapy as prevention and not always as intervention. I want to really thank all of you for participating. We are going to make ourselves available to answer any other additional questions in the hallway. Thank you once again for participating.